Avis Lunty.
And I'm Taylor Emanuel.
Today, we will be doing a segment on chiropractic practice versus Western medication treatment specifically towards asthma.
Chiropractic practice is done by well-educated chiropractors. Their job is to help treat pain and illness by using manipulation to the spine. Sharp, precise thrusting movement of a joint are thought to help free swelling, inflammation, and pressure to the spine. The vertebrae slipping out of alignment, subluxation, could pinch the spinal nerves and cause moderate to severe pain, as well as interfere with nerve functions, leading to a variety of health issues.
People that are stressed, have poor posture, or have been in accidents, precisely sports incidents, are typical chiropractic patients because these factors, or chiropractors believe, can stop the body from running like a well-oiled machine. Patients with health issues such as digestive problems, menstrual pains, and even headaches, migraines have been said to find chiropractic helpful. There are many chiropractic practices around you, but you cannot find a chiropractor in a government medical institution.
This all began in 1895 when Daniel Palmer, who taught himself anatomy and magnetic healing, believed that he could treat disorders throughout the body by using his hands to move the vertebrae back into their proper positions and restore proper nerve flow. In the building that Dr. Palmer worked, the head of the janitorial service, Harvey Lillard, was deaf, and when Palmer asked what the cause of deafness, Lillard said that 17 years prior to that date, he strained his back, and when he did so he heard a pop, which then led to his loss of hearing. When Palmer examined Lillard's spine, he observed a misaligned vertebrae. This caused pressure on surrounding nerves, and when Palmer adjusted Lillard's spine, his hearing problem improved.
There are spiritual and cultural aspects of chiropractic manipulation. The chiropractic profession emphasizes the natural power of the body to heal itself, homeostasis, and therefore, chiropractic practice does not include the use of drugs or surgery. It embraces the holistic nature of the human body, including health, well-being, and the doctor-patient relationship.
Although there have been many struggles to find a scientific explanation for chiropractic manipulation, chiropractors have determined that chiropractic adjustments have a direct effect on musculoskeletal structures including muscles, ligaments, joints, joint capsules, and surrounding myofascial tissues, and reduce pain while increasing joint motion.
To become a chiropractor, one must complete a minimum of 90 semester hours of undergraduate education and 4,200 instructional hours of full-time chiropractic education before attending chiropractic school. After education is completed, licenses are given to those who meet educational requirements of the state they would like to be licensed in, and they must pass a state-approved board examination.
Chiropractors believe that they can use these manipulations to treat asthma and other ailments. Asthma causes recurring periods of wheezing, chest tightness, shortness of breath, and coughing. Many people with asthma report improvement after receiving chiropractic care. This is because the lungs and diaphragm are controlled by your nervous system, which chiropractic manipulation supposedly affects. Nerves that control these areas leave the brain, travel down the spinal cord, and exit the mid-cervical and thoracic regions of the spine.
Subluxation in these areas of the spine can interfere with the nerve supply to the lungs, causing the lungs to function abnormally. A chiropractor would correct the subluxations, restoring proper nerve supply to the lungs, allowing the lungs to function optimally. For instance, a study published in the Journal of Vertebral Subluxation Research documented the result of 81 children with asthma who received chiropractic care. The 2-month study revealed that those under chiropractic care who reported asthma attacks before the study saw a 45% decrease in the number of attacks, and that 31% of volunteers chose to decrease their medication.
All this occurred because of improved nervous system control of the lungs. Although studies show these effects in Western medicine does agree that there is such thing as vertebral misalignment, critics in Western medication do not believe that misalignment affects asthma. They use more of an artificial way to treat asthma rather than natural.
Western medicine include treatments such as medicines, inhalers, steroids, and other inflammatory drugs, bronchodilators, nebulizers, and prednisone. These asthma medications are for quick relief and long-term control.
Chiropractors oppose the idea of medicating, which can be dangerous, while those in Western medicine criticize that there is no 100% guarantee that chiropractic manipulation truly improves any organic disease or vertical misalignment had any effect on the function of the lungs.
Now we have a special guest, Frank Russo, from the Biology Lab at Bronx Community College. Can you briefly describe what asthma is and the biological aspects of it?
Asthma is caused by inflammation in the airways. When an asthma attack occurs, the muscles surrounding the airways become tight and the lining of the air passages swells. This reduces the amount of air that can pass by. Asthma is caused by a combination of genetic and environmental factors. Environmental factors include being exposed to allergens, air pollution, and other environmental chemicals. While the role of genetics is not yet fully understood, it is more likely to occur if you have parents with asthma.
What are the Western medicines used to treat asthma and how they work?
Western medications for asthma treatment are medicines, inhalers, steroids, and other inflammatory drugs, bronchodilators, and nebulizers. Medications such as steroids and other inflammatory drugs are designed to prevent asthma attacks by reducing swelling and mucus production in the airways. Generally, there are two types of bronchodilators, short-acting and long-acting. Short-acting bronchodilators quickly relieve coughing, wheezing, chest tightness, and shortness of breath. Long-acting bronchodilators are used for controlled asthma with inhaled steroids. Inhalers are simply handheld devices that directly deliver medication to the lungs. Nebulizers are breathing machines that allow medication to be changed from liquid to mist, making it easier to inhale into the lungs. When suffering from a serious asthma attack, prednisone is prescribed.
Being a part of the Western medicine side of things, what do you think about the method of chiropractic manipulation?
I admire chiropractic manipulation. I admire the naturalness of it, and in some cases trust it, but I advise Western medication.
How well do you think chiropractic manipulation works?
I am not entirely positive how well chiropractic manipulation works. I don't doubt that it is relaxing or that it isn't effective in any way, but I'm skeptical of the claims that it improves certain conditions like menstrual pain. This seems bizarre.
Do you believe that chiropractic manipulation does indeed affect the operation of the lungs?
To be honest, I do believe that chiropractic manipulation does affect the operation of the lungs. I don't doubt patients that state their asthma has improved, because if it hadn't, those patients wouldn't decrease the amount of medication they use for it. Obviously, if there is a decrease in the amount of attacks patients are having, something is working.
What are the benefits of using Western medication to treat asthma, and how are they better than those of chiropractic manipulation?
The benefits of using Western medicine's method to treat asthma are that the medicine provided is always accessible. Chiropractic manipulation doesn't get rid of the attacks the patients have. Therefore, it is basically required that asthmatics have inhalers or whatever medication with them, because when they have an attack, they need something to help them immediately. What do chiropractors give you to keep you under control when you are with them?
Why doesn't Western medication believe that chiropractic manipulation can improve the operation of the lungs?
It's not that we don't believe that chiropractic manipulation works. In fact, I do believe it works. I just don't believe it is as trustworthy or effective as Western medicines.
Would you recommend chiropractic manipulation?
In some cases, yes, I would. Tons of people find chiropractic helpful. There there are just certain factors you have to take into account, such as age, physical abilities, and other things. I trust that when first attending chiropractic, patients will be assessed for these factors before being manipulated.
Are there clear benefits of chiropractic manipulation that you can recognize as a member of Western medicine?
There are things that I admire about chiropractic. The naturalness most. It's obvious that chiropractic manipulation does work, because if it didn't, it wouldn't be as strong and profitable as it continues to be.
Chiropractic manipulation and Western medicine have their strengths and weaknesses. The alternative model incorporates your whole life and the holistic aspect of it. It promotes a calmer, less scientific view of things, being treated but being treated comfortably. You don't have to worry about the risks of taking medications. On the other hand, you aren't entirely sure of the legitimacy of the practice. There's no 100% guarantee that the treatment will be effective or work. The Western treatment model is more legitimate. You can depend more on this model than chiropractic. On the other hand, you do not get the same comfort and liberality that you do with the alternative model.
Personally, we do not oppose the practice because many people, including loved ones, say that they do feel better after seeing a chiropractor. If your spine is misaligned and your back is uncomfortable, then we recommend seeing one. But attending a chiropractor once often means you have to begin attending one regularly.
We would not use this practice because, although we are physically active, we believe that we are too young. As stated before, once you see a chiropractor, going back time after time is often required, and beginning such a routine this early on in our lives isn't ideal.
Based on the articles we've read, we believe that there is very little chance of there being a place for alternative medicine in Western medicine. They have very different opinions and beliefs. Western medicine focuses more on the scientific aspect of things, and alternative focuses more on the spiritual. And this concludes our segment for today. Thank you.
See you next time on 15 Minutes.